After we give you the treatment options, the most common question I receive from the patients is what to expect complications during the procedures. These procedures are very minimally invasive procedures. Complication rates are extremely low. The most common complications you should expect here in the office is bleeding at the site of the catheter, either in the groin or in the foot. These bleeding rates can be minimized by watching you here for 2 hours and making sure that you go home. We give you a call on the next day, make sure that you're doing fine. The blood thinning levels are extremely minimal during these procedures. So the bleeding in the body is expected and we will go over it before we start the procedure. Dye complications can be expected during this procedure. But if you have had a problem with the dye, if you have had a problem with the kidneys, these procedures can be done without any dye, just based on ultrasounds. Problems with the leg, the vessels getting burst out, or as we call it, perforations, can be expected during these procedures, or certain vascular complications can be expected during these procedures. These procedures are so minimal that can be completed without minimal complications. Patients usually can go home and completely get back to their normal lifestyle after these procedures. Most of the patients should go through these procedures without any major problems. When you are here at New York Heart Vascular, we will go over every single complication. We'll take time to talk to you and we'll try to minimize these complications as much as we can.